welcome to this second part of the talk on varicose veins and also associated conditions like piles and varicose. In the first part, we were basically focusing on the causes and the general understanding of the status of these conditions. In the second part, we look at what are the current medical treatments that focus on varicose vein, piles and varicose, with primary focus on varicose veins. To begin with, the first question is, can varicose veins be permanently treated?
Varicose veins is really a complicated matter actually when we look into the real basics of the disease. So usually what we do is, in the modern medicine, when the varicose vein, remove that vein. That is the system we are applying till recently. If the varicose vein initially, when 40 years back and all, we are removing, the stripping is the only surgery, that removing the superficial veins. There are deep veins also. Then we think that the deep vein will take care of the flow of the blood. And superficial means we are seeing only that the subcutaneous vessels. The major blood vessels are lying in the calf muscles actually, inside the muscle. And there is perforators, that is these superficial vessels and the deep vessels are connected actually with the special connecting vessels. So if you remove the blood vessel by doing the stripping, definitely the vessel will go for a long time, there will not be any blood, varicose veins will be seen. At least partly it will not be seen. Then the treatment developed like sclerotherapy. Some chemicals is injected into the blood vessels to shrink it. There also the blood vessel is got damaged and there is no road for the flow of blood. And actually these are all canals flowing blood and taking it to the heart. So you are destroying the canals actually by all these surgeries. Even then came the laser. Laser probes are introduced into the vessel and then your heating or whatever is doing, and that also is damaging. Then ultrasound probes, that also heating, making some vibrations or whatever heating are damaging. And even steam is used to damaging the vessels actually. All these procedures which is used as a destroying the blood vessels, and later some venosyl type of chemicals which is injected into this upper part of the saphenous vein, that is the thighs level, that is the major vessel is coming there. No? That the upper part itself, that vessel is blocked. So many procedures are, everything is actually blocking. Actually the problem lies with the obesity, high intra-abdominal pressure, and also now in the latest understanding is that is, you might have heard about homocysteine. Homocysteine is an amino acid. This amino acid level is very high in many of the, it is considered as a cardiac marker. If the homocysteine is high, heart disease, heart attack chance is very high. And now the latest study shows that venous ulcers patients, this homocysteine level will be very high, usually high. That homocysteine is an amino acid which is used for the production of this many of our protein. It is a protein amino acid is used for making protein for the body. But this is why it is increasing in these heart patients and in the varicose vein patients. Is there are certain vitamins, folic acid, B6 and B12 and all, is needed for homocysteine metabolism. And when they are not there, this homocysteine will accumulate in the body. And this is acting as a corrosive for the blood vessels. Not only the varicose veins, it is the arteries also getting damaged. That's why it is taken as a cardiac marker actually. So what we should see, ideally when you look into the treatment, you should find out this basic cause and correct it. But previously we were not aware of this basic mechanisms like at the cellular level or then the molecular level mechanisms we were not knowing. Then that time we have developed all these procedures, but it is still continuing because the medical system is going with the procedures and medicines. There's no medicine for the varicose veins or the piles, not much effective medicines, only very few flavonoids, that is plant-derived material, aspirin, and which is used. But it has only limited role for some symptomatic relief for this thing. And the surgeries are on the other side is destructive, and there's no effective medicine. Then till now, we were not having much understanding about this disease at all. Now we have better understanding and we have to correct it, the basic mechanisms of the disease itself.
Actually, you were mentioning about how these vessels are, if there is a problem of varicose veins, the very vessels itself are destroyed or removed and all that. So, there are so many ways in which it is done, like sclerotherapy, then by actually making tiny skin incisions and removing the veins, then laser, and as you said, ultrasound and all that. So, what is the understanding of, if there are 4 different varieties, what does that actually imply on treatment?
See, this micro-invasive surgery, when the patient hears, they'll think that micro-invasive, so few small wounds will be there. What is it is done? Your problem is not on this external vessel alone. Your problem is, the major problem will be in the internal vessel itself, this deep femoral vein. It is where you are seeing it on the superficial femoral vein, subcutaneous. Actually, when you are removing, that is micro-invasive surgery, you will be the part, small incisions are put, and it is, you are removing that vein from that part. 10 or 20 centimeters interval, putting small incision and removing the vein from that. When the vein is removed, there will not be any collection in the vein, and you feel that you are cured of the disease. But we just simply imagine if a road is blocked and you are just some puddles are there, you are just blocking that road itself, then how this blood will flow? That is the question. And there will be perforators. Actually, there is this connecting blood vessels are there to the deep vein and the superficial vein. This damage is not happening in the superficial vein alone. The deep veins also is getting damaged. But when you are removing that, the new blood vessels has to develop, at least the body will try to develop some way to flow of blood. But the mechanism there is an innate problem with the blood vessels itself. So if a new blood vessel if a new blood vessels is produced also, that also will be having this problem. That is why many of these patients, after the surgery, this recurrence comes, and also the bleeding. Even it is all the superficial veins are removed, also the patient can get the bleeding varicose veins. And the skin will get damaged. Skin, because there's no proper flow of waste material and nutrition. Nutrition and waste material flow is not there, and the skin will be getting damaged. And that is the reason for the itching and the skin lesions, and finally non-healing ulcers and all. And the darkening. Many of the patients with varicose veins will be this leg will be swollen and dark. And many people actually binding it with this elastocrete bandage, or putting this because of the very unpleasant sight of the leg itself. And they will be covering it and living like that for many. And I had seen patients who had discussed, and their relatives or the children or the wife itself never seen the situation of their legs, especially with the non-healing ulcers. So it is what should understand that those people will be having already 2 or 3 surgeries and many type of problems, treatment they might have tried. But after each treatment, the problem will be increasing, because every treatment, this surgical treatment or this sclerotherapy or the chemical injection or radiation or laser therapy, actually everything, the destruction only is happening. There's no rebuilding is happening. So if you have to rebuild the vein, you have to find out the real cause of it and try to correct it, and give correct nutrition and correct exercise, and reduce the toxin level also. If you are so much obese and your abdominal fat is so high and the pressure is high, and you are not making any effort to reduce this excess tummy fat, which is increasing the venous pressure, You're just removing the vein will not help you. So you cannot go for surgery or go for, there's no medicines, no, surgery will not cure you. But the only thing what you can do is you find out the cause, reduce this if you have excess pressure or excess intra-abdominal pressure because of the excess fat, reduce it. That will itself cure you and the discomforts will be reduced. And also give proper nourishment. If the homocysteine level is high, that means even your vitamins, the complex vitamins is at you don't have enough vitamins, or you're eating so much of junk food. That because vitamins, this B complex group of vitamins and all the vitamins is needed for processing of the your food. If you're eating only junk food, means there's no vitamin. There's all this fries and this artificial things and all. It's it doesn't have any nutrient and all the calorie will be there, and even protein, too much of protein. This need for processing all these things, all the vitamin is needed. If there is not enough vitamin, even the protein is becoming toxic for you. It's a homocysteine is an example for that. If you're eating too much of protein and there's not enough vitamin to process that, that is corroding your blood vessels. You're eating too much of carbohydrate, you're diabetic, too much of carbohydrate, blood glucose is high, it is also corroding your blood vessels. So these are the things you have to take care. Then you'll be able to get out of the disease.
Actually, when you're talking of varicose veins, visibly we are talking of bulging veins and all that. But there is always the problem that we hear that those who are having varicose vein, they also have leg pain. That is pain within the leg, in the middle of the leg and all that. So what is it that is normally possible for such situations?
See, when you have pain and varicose vein, there is if you had a ultrasound scan, you can see whether there is your deep veins also having damaged valves. And if the deep vein also, most of the patients with the varicose veins having leg pain, that stage there will be deep vein valve damage also will be there, and also the perforators also may be damaged. So the retrograde flow also will be coming. The retrograde flow, and when the muscle is contracting, because of the perforators are damaged, the blood is coming to the subcutaneous tissue, that is the superficial veins also. So because of the toxin is accumulating there and the nutrition is not proper, the leg is getting pain. And immediate relief, you just raise your leg. That is a simple method of doing. If you can raise the 50 to 70 degree up and above the heart level, the blood will flow into the heart and you get a relief because of that. So varicose vein patients, if they're standing for a long time and then if you feel it, just lie down if possible, or at least raise your legs. And that is the simple mechanism you can do. And this elastic rib bandage and this special socks, that also will help, because it will help in the way that the superficial veins will be supported so that it will not get too much dilated. So even this perforators is damaged, it will help you. But it will not only that mechanical support. It is not a curing, it is a mechanical support only.
Actually, when we are talking about varicose veins, another common issue is that the legs themselves seem to swell. Not only the veins, but the whole leg seems to swell. So how does this removing of varicose vein, how does that help into reducing this swelling of the legs?
If already the swelling of the leg is reached, actually if you go for surgery, you will be getting more deeper into the problems. Because there's no way surgery, it is actually destroying already the existing blood vessels, and you'll go into deeper problem. The surgeries are usually done in an early stage when there is no much of the symptoms, and only or slight symptoms are there, and you can get a really good cosmetic result. But if you do surgery in a later stage, you will be. I had seen many patients who have done repeated surgeries, and they are landing with, after each surgery, they will be landing with more and more trouble. And only initially there will be only itching and the edema, and it may end up with the ulcer also. If you are going for in that stage, generally, I am generalizing. Generally speaking, that will be the problem, because you are already there is a problem and you are aggravating, because each of the surgeries are actually not making any new route for the blood to flow or new canals to blood to flow. We are just removing that or destroying the already existing canals.
Actually, when we are talking of varicose vein treatment by removal or by blocking and closing these blood vessels, uh, very similar, it seems, is the approach to treating piles also, with procedures that do something very similar. So, what is that approach, and why is it that generally there is a fear that piles, once it comes, whatever you do, it will come again? So that sort of fear is always there.
The same reason for the varicose veins itself. Because if there is a method to, this body is always want the circulation and the functioning properly, want the body to function properly. So what you are doing, you are knowing that is actually this blood vessels, this venous system is there as a anal cushion, it is called. It is actually the supportive area there, and there is very clear connection with the food you eat and this varicose vein or varicocele or the piles. The relation you can very easily find by yourself by seeing the piles changes. Those patients who are knowing having piles, everyone knows that certain food will aggravate the condition. And I have seen many patients with the piles and varicose vein. Usually, the piles patients, they can understand the relation easily, because after their clinically supported, I'm giving actually clinically supported lifestyle correction, and when they are in the system, that the piles problem will be reduced and the varicose everything will be reduced. And if it is varicose vein also, or even the ulcer patients also can understand. The varicose ulcer patients, they can understand the connection with the this relationship with the food, because it will immediately manifest there. And they themselves start reducing more. Very good amount of patients say that the chicken or the egg can be is troubling them. But if they take the duck egg, they don't have much of the problem. So they will themselves be able to find out. But when in the clinically supported lifestyle correction, we are checking with the blood itself. We can see what is how your immune system is reacting to your own food, and you don't have to blanketly avoiding milk or egg or anything. You can find out which is actually creating problem and avoid that alone. So it will be more easier, and you will have the choice of different food, at least that's to those who are creating problem for you. You can avoid, and it is applicable not only for the piles, the same for the varicose. That is to protect your blood vessels. It's very important that whichever food is creating problem for you. Also, you have to find out.
Generally, it is felt that if this varicocele problem is severe, or if this piles problem is severe, or even this vein issues are severe, then taking invasive procedures like surgical procedures and others are actually increasing the risk. Uh, Normally, when the problem is severe, generally people tend to look at it from a surgery point of view. But why is in the case of these issues that surgery point of view is considered safest at the beginning stages?
It is not safest. Generally, people think that they undergo surgery, also thinking that if you remove this, you won't get develop the problem, because we all think that in the prevention is better than cure. We are thinking, but in the varicose vein and the piles and this varicocele and all, because of the last 40, 50 years of history, medical history or medical advanced medical literature itself shows that there is not, you cannot prevent it. It's not that prevention. You are only destroying. What if you really want to prevent it? You have to find out what you should find out which food is creating problem for you, which whether you have whether any thing is producing increasing the intra-abdominal pressure or intravenous pressure. The reasons for the intravenous pressure should be avoided, and find out the junk food or whatever, or the nutritional deficiencies or the toxin which is accumulating in your body. And the latest understanding is actually this about the piles and the varicose veins and all. It's a slow progressive autoimmune disease. The immune system is actually working against your if it is piles, it is the anal cushion against the anal cushion, and that is a latest understanding. And because of this biopsies and all is showing that there is infiltration of the or inflammation is there. The same thing is happening for the legs also. Actually, you are just hiding in the initial stages. This hiding will help you of not showing cosmetic effect. And even there are patients who are coming for this when they go for some physical test for this joining in the army or the defense force or the police. If you have a varicose vein or something, it can the prospect for them to get the job can be reduced. So they go and do the surgery for the especially the sclerotherapy and laser, because there will be only a small part will be there, a small vein will be affected, and at that stage, if you do that, the cosmetic result will be there, but it will not hide you. I mean, it will not help you in the progress of the disease. If you want at that stage, if you are doing okay, if you want a cosmetic result for a small vessel, small 2 or 3 centimeters or 1 or 2 varicose part, you can do the surgery and you can get a benefit from that. But along with that, you should find out what is the real cause of your problem, and it can run in the families. If the mother is having varicose vein, the son or the daughter can have the possibility. So they had to correct what is your food which is damaging you, whether you have any other factors which can damage your blood vessel. So if you can do that also, then you can be saved.
Normally, in this varicose vein and piles and varicocele and all that, if there is a element of pain, there is a role for painkillers nowadays. Generally, people tend to use painkillers. What are the plus and minus of using painkillers for such a situation?
The painkillers has a role if you have pain because of the ulcer on the leg or a clotted blood external piles, then there will be severe pain. If you take the painkillers, definitely the pain will be reduced. Otherwise, there is no only for that symptomatic relief that painkillers has a role. You cannot continue the painkillers for a long time, and if the pain is there, that means there is more than that, there is dilatation, there is inflammation, and other things are also there. So you have to see what is the problem and to correct that too.
Similarly, we also see that in the case of varicocele also, generally, whatever be the treatments, again, it seems to repeat or develop. So, what is it that can be looked at for that?
See, for the varicose vein, we don't know whether the recurrence, how much is happening and all. But varicose vein actually is a botheration only for the men who's having infertility. But there are so many studies which is done that there are people who are with varicose veins, varicose vein, they're getting normal pregnancy also. Only when you're having a problem or an infertility problem, you're looking into this. And even in the first and second and third level, first and second grade, that is the initial stages, there is no role for a surgery at all for the varicose veins. For the fourth stage, it's really very bad condition, so much of vascular damage, this valvular damage. Then if the patient is having pain and all, that's total pain, then there is you can do the surgery, but there is not much effect on the fertility improvement. That is what the studies shows. It is very controversial for the varicose vein surgery for the this infertility people, because of the surgery there is again damage is happening, and also even the nerves can be get damaged. So it can even the result can be more. The problem can be the count can be reduced also. So even the sperm count will be reduced. So that is, if you are going for a varicose vein, and don't think that it is a curative thing, and you should really think twice or thrice before going for the surgery.
With this, we come to the end of the second part on this subject of varicose vein, piles, and varicoceles also as adjacent subjects. And in this next part, we will be looking at the general comorbidities that is, the other disorders and diseases that usually come associated with varicose vein or piles or varicose, and then the way complications normally arise and what are the challenges while treating such complex situations. Thank you.